The views and opinions expressed during this program are those of the hosts, guests, and callers and are not necessarily those of this station, its management, or other employees, advertisers, or sponsors.
Good morning. It is Tuesday, October 1st. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining us this morning from Logansport Memorial Hospital, Vicki Bird is here, and it's kind of a special day today.
It is. We're here to actually celebrate Breast Cancer Awareness Month, and I have 4 special guests with us today, so we're pleased to do that. I have Dr. James Hall, who is with our Women's Health Center and has been with Logansport Memorial Hospital and practiced in Logansport for many years. I'm not sure how many you've practiced,
Since
Dr.
1978.
Since 1978. And then I also have 3 breast cancer survivors that are going to be talking with us today during the show. I have Corrine Chittum, Marianne Hill, and Lana Moss. So we're so happy that they're here and joining us today. And you may have noticed their pictures on our billboard this month as we're getting ready for our River Bluff Run and celebrating breast cancer awareness.
And where is that billboard located?
It is on 5th and Market.
Okay, so downtown.
Very prominent, right downtown.
All right. Well, welcome, ladies.
Thank you.
And Dr. Hall, let's start with you and tell us a little bit. I mean, we kind of got into it with the amount of time you've been here, but a little bit about yourself and your background.
Well, I grew up in Logansport and do a little microphone adjustment here. Went away to school and graduated from Indiana University's medical school and came back to Logansport after completing my residency in obstetrics and gynecology. Joined my dad, who was a gynecologist, obstetrician here in town, who had been here since 1948. So the roots of Women's Health Center started here in 1948 with 1 physician, and now we're at 5. So it's grown quite a bit. And women's health care has always been of interest to me, primarily, I guess, because of my dad's interest in that, and it was a good fit in medical school and residency. And it was an exciting opportunity to come here and try to expand the services here.
And, I mean, what a great story of someone coming back to Logansport and doing all the things that you've done here.
Well, it was a good fit. It's been a great place to raise the kids and family, and it's a good town.
Now, you have an extensive background in breast health. Can you tell us a little bit more about why that's a passion of yours?
It fits into women's health care, and in the United States today, as opposed to in the past, breast health has had most training programs has been moved a little bit away from the gynecology training program. I never really bought into that and thought it was probably part of what should be gynecology. So I did extra work in medical school, took some fellowships and things that you could do, and then during residency had some interest in it and did some extra work. And then along the way have had an opportunity to be involved with some wonderful mentors who were very, very bright and on the edge of the curve of new things. And so I spent some time down at Baylor in Dallas at their breast cancer fellowship program, and some time with other physicians around. Became very, very good friends with a physician from University of Southern California who ran their breast care clinic in Southern California, and he and I did several teaching courses around the country for the American College of OBGYN. Was fortunate enough to go to Southern Cal and actually work in their breast care clinic, and was fortunate enough to be able to go out and actually do some teaching at Southern Cal with them. And so it's like a lot of things, you become interested in it and you hang around with people who do it and try to assimilate as much into your education as you can. And it's been really nice to bring services that a lot of smaller communities don't have here. But obviously you can do those things here. You just have to put a little bit of effort into it.
And that was one of the things that struck me, as you said that the Women's Health Center, its origins actually began in the late 1940s. And is that something that's unique kind of for our community?
I think so, and probably the unique part of it is that when you've got multi-generational families from 30, 40, 50 miles away, and so I see patients who, actually there are a couple of them who are still around who were early patients in 1948. We've still got some charts that go back that far, but you've got patients who maybe my dad did surgery or delivered their babies of now great grandkids, and it's a nice longitudinal care. And I guess I was remit in discussing mentors. Of course, my dad was probably the best mentor along. He had a unique educational path in that he finished medical school and his internship, and then World War II started, and the government made him a general surgeon. And then he came back and did his OBGYN residency. So when he came to Logansport, there wasn't hardly anything that he wasn't willing to take to the operating room, and had good training to do it. And he was a very big advocate that breast health should be part of gynecology. And he pounded that in my head pretty hard.
Now, we hear a lot about breast cancer. Can you give us some statistics about the disease?
Breast cancer is the number one cancer that women have, short of skin cancers. Probably the second leading cause of death next to lung cancer. But overall, breast cancer rates are pretty level right now. There was an increase for a while, but right now it's pretty level. The most exciting thing about breast cancer statistics is that of all women diagnosed today, well over 90% will survive. And that's because of screening programs and better treatments. So it's gone in my career from one of the lesser survivable diseases to now to one of the most survivable diseases. And that's come through screening programs and better treatments.
Some of the statistics provided here and some information from the hospital, the chance of a woman having invasive breast cancer sometime during her life is about 1 in 8. That seems like a very high number.
Well, liars figure and figures lie. 1 in 8 means that if you live to be 95 years old, sometime during your 95 years, 1 in 8 women will have had a breast cancer, about 12.5%. If your life expectancy is not 95, then the statistics go down. And that doesn't mean if you got 8 women in a room, 1 out of 8 has breast cancer. It means sometime during their lifetime. And so when you figure over a span of 95 years, there are a lot of things that happen 12.5% of the time during 95 years. So I think it's something to be aware of, but it's not something to become paranoid about or lose a lot of sleep over. It doesn't mean anybody's destined to have the disease.
Now, as far as the survival rates, you attributed some of that to the screenings and some of the detection methods that are available. And let's talk a little bit about screening mammograms and why those are so important.
Well, breast cancers go through a very, very slow growth phase. The average breast cancer by cell division rates, and it's an average, so some go quicker, some go slower. From the beginning, whatever starts it, we don't know, but whatever starts a breast cancer, to grow to 1 centimeter, which is roughly a little bit less than a half an inch, most breast cancers have been there 6 to 10 years. They don't happen overnight. They grow very, very slowly. Well, until they get to someplace in that size range, they're not detectable. You would never know they're there. There's no way of knowing they're there. And there's something magical about 1 centimeter in size, again, about a half an inch, that breast cancers prior to that size rarely, if ever, spread anywhere. They just sit there. And so the most important thing to do is find the breast cancers when they're small. And something that's small, you're not going to have any symptoms from it. It's not going to be any pain. There's not going to be any redness or any nipple discharge. You're not going to be able to feel it. The only way you're going to find it's with some kind of an imaging test. And that's where mammography comes in. And the mammogram evolution has been phenomenal from way back when it was a converted chest x-ray machine to now the digital computer-driven mammograms. We can find things that are 3 or 4 millimeters, which is 1/8 of an inch. And those are almost always curable. But you have to find them as early as you can. And then with all of the treatment modalities of chemotherapies and hormone blocker drugs, radiation therapy, those that are treated are not only treated very, very well, but a lot of the treatments have a prophylactic benefit of reducing the chances of getting another breast cancer in the other breast. So, for example, the hormone blocker drugs like tamoxifen or Arimidex probably reduce the incidence of breast cancer on the other side as much as 60%. And so, we're not only treating the cancers that somebody has, but we're reducing the risk of it ever coming back or a new one ever coming in the other side.
Now, what is BRAC testing?
Well, BRAC or BRCA or BRCA, however you want to pronounce it, is a gene test that is a gene found on, and there's BRCA1 and BRCA2, found on the 13 and 17 chromosome for the geneticists in the crowd. A long time ago, somebody very bright, much brighter than me, figured out that we make bad cells every day in our bodies, and that we all possess tumor suppressor genes. We possess genes that go find those bad cells and wipe them out. Some women, and it's an inheritable thing, do not possess those genes. They have a mutation, and it prevents those genes from working. So they're really tumor suppressor genes. And if you have a BRCA1 or BRCA2 mutation, then the incidence of breast cancer, ovarian cancer, melanoma, prostate cancer, colon cancer go way, way up. And, of course, the most famous person recently was the actress Angelina Jolie, who her mother had ovarian cancer. Her mother was tested. She had a gene mutation, so the actress was tested. She had the gene mutation, and she recently had both breasts prophylactically removed, and at some point in time she'll have her ovaries removed down the road. So it's not a test that we do for screening. It's a test that we do on somebody who's actually had a cancer. It's most accurate that way. And then if the test is positive for the mutation, then we test the relatives. But if the person with a cancer is BRCA negative, meaning they do not have the mutation, then the rest of the family doesn't need tested because you can't pass on something that you don't have. But even so, we don't test everybody with it because statistically there has to be so many family members with it in order to even have a chance of having the mutation. So if you got a single person in the family, then mathematically the odds of being a BRCA mutation is so slim that we don't generally test for that. So even in the worst family histories, less than 10% of those family histories actually have the gene mutation.
You obviously know a lot about all of this. You really know your stuff, and it's fascinating to hear you talk about all of this. But I think where it really hits home for people is when they know someone who is then diagnosed with breast cancer. So we'll kind of shift to you guys as survivors of breast cancer and kind of, I guess, walk us through your story, if you would. And can we start with you, Corinne?
Okay. I have my mammograms every year. I have flunked a lot of them. So when I flunked this one, I really didn't take it to heart. And then they went back and tested again, and sure enough, it was cancer. Nobody in my family has ever had breast cancer. Nobody in my family has had cancer. So you just think, well, I'm not going to get cancer. Well, I did. Mine was hormonal cancer. I had 2 surgeries. Then the doctor told me that at first I was only going to have radiation. Then they come back and said I had to have chemo because he said he was afraid because it grew so big just in less than a year that it would come back in my bones and I wouldn't have a chance. So I went through the chemo, and I can tell you mine wasn't good. And chemo is different on every person. And then I had my radiation, and now I'm just thankful for every day that I have. It makes you appreciate the sky. It makes you appreciate everything around you. I feel like that if the Lord gives me 20 more years, then I'm a very blessed lady. But I will say this, you try not to be scared. You try not to think about it. But I'm due for another mammogram, and in the back of my mind, it's a little scary, But Dr. Hall's got me through this. I trust him completely, so I'm in his hands. So I think I'm going to be fine. But I am on the hormone blockers. I have to take those for 5 years. It's just a pill every day. So I just try to do what I need to do, and I think a lot of it is what you eat, how you take care of yourself. But the main thing I would say is that mental attitude. You've got to be positive. But if I could say anything to the ladies out there is please go get your mammogram. It's a small price to pay to save your life.
Thank you for sharing that story. Marianne, what about you?
I've gone through, sounds like most of the same treatment as Corinne, and I also I'm due for my mammogram next week, and I'm a bit nervous also, but I know things will be fine. I've gone through this, and hopefully I don't have to go through it again, but if I do, I know I'll be fine. I also had mammograms every single year up until the year prior to last year, and I had seen Dr. Hall for other medical issues. And I was being released, and he said, hey, you haven't had your mammogram, what do you think? And I said, well, let's go ahead and do it. So I went and scheduled a mammogram and had that, and I was surprised when they came back and said we need to do some other testing. And so they did the tests, and Dr. Hall then said, yes, you do have breast cancer. We're going to remove lymph nodes. We're going to remove the lump. He assured me through everything that I would be fine, and went through chemo, radiation. I'm also taking medication. I just kept upbeat and positive also. You have to have a positive attitude. That is so much of it. You need to have friends and family, if you can, that can help you out. And I also want to urge women to have a mammogram. Even if, like I said, Corinne had one every year. I missed 1 year. Things happen. You just, as Dr. Hall said, that cancer stays in your body and you don't even know it's there. And it just one day decides to pop its ugly head out. And you just need to do what the doctors say. The doctors know what needs to be done, and you just need to follow their advice and take care of yourself.
Thanks for sharing your story as well. And Lana?
Well, I'm the oddball of the group. I always had my mammograms every year. And this one time, when I had the cancer the first time, I just finished my second round with it. I was sitting there in the living room, and my breast itched, so I scratched it. And I felt a lump. And I thought, uh-oh, that's not supposed to be there. And I had just had a mammogram 6 months before. So I called them, and they did an ultrasound, and sure enough, it was stage 2, HER2 positive. So Dr. Hall said, this is an aggressive cancer, let's treat it aggressively. And I said, I'm with you. So we did the surgery, we did the chemo and the radiation, and I thank God for Herceptin. That was a drug that was just new, I think, at that time. And I took a year of that, and I'm fine. Then 7 years go by, and last year, a little over a year ago, I was due for my mammogram again. Oh, and I might mention, the first cancer, the cancer did not show up. And after they diagnosed it, they said, well, who told you that you had cancer? And I said, pathology. There was no evidence of it on any of my mammograms before or after. So that was a freak thing. Well, this time I go in for my mammogram, and he calls me back, and we did a needle biopsy. And sure enough, it wasn't quite stage 1 yet. But they found it on the other side. But I like to keep things even, so why not do it both sides, So, but anyhow, I've had the chemo, I've had the radiation, I've had the surgery. Fortunately, I never got sick. The first cancer, I got sick 4 times in the year. That was it. The second cancer, of course, I had to have the shots 2 days after my surgery, or after my last chemo. The shots didn't make me sick, except just made me hurt and tired. And I beat that again. So this time it was it was triple negative. The first time it was HER2 positive. This time it was triple negative. Now, thank God I don't have any more breasts, because I'm not going to give it a chance to come back again. But I'm all for getting your mammogram because, I had them. It didn't show. And a little bit of self-breast examination doesn't hurt. I mean, I was no great person at doing it. But since then, I've learned. I check myself every now and then because you never know what's going to come up.
And Dr. Hall, I'm sure that this is something that you echo on a daily basis, but having 3 survivors here who have fought the disease and won, I don't think you could have a better testament for going out and getting those screenings that you need to have done.
Well, these are great ambassadors for, how to assimilate something like this in your life and not let it take over your life. There's probably nobody around that either hasn't had cancer or had a close family member with it. And so it's something that's not unique to one person, and so it's a journey, and it's each step's a little different, and after a year or two, the steps get easier, and down the road there's some reorganization of your life and life's attitudes, and I think everybody learns to not sweat the small stuff. The one thing I will say about Lana's situation is, unfortunately, we have no test that's 100%. We have no treatment that's 100%, and so. Mammograms are the best thing around to find early breast cancer, but not all breast cancers image. Probably about 90-95% do. If you throw the clinical exam or self-breast exam with a mammogram, those that are detectable, that are big enough to be seen or felt, you're probably going to find a good 95+% of them. And so that the value of mammography is doing it on a regular basis. A single picture may not show anything, but over a period of time, coupled with exams, we're going to find most of them. But again, I wish we had 100% of something, but that doesn't exist.
Well, thank you all for sharing your stories, and we'll take a quick break, and we will be back with more Talk of the Town, talking today with representatives from Logansport Memorial Hospital.
America's best music.
Good morning. We are back with more Talk of the Town. I'm Michelle Dials, talking this morning with representatives from Logansport Memorial Hospital, and this is Breast Cancer Awareness Month, October, the whole month of October. Is that correct?
It is correct.
All right. So we're talking this morning. Vicki Bird is here, Dr. James Hall, and then we have 3 survivors of the breast cancer disease. Corinne Chittum, Marianne Hill, and Lana Moss are here with us. And we heard your stories earlier today, and I wish during the break people could have heard some of the things that we were talking about, because the stories that you guys have to tell are so interesting, and I think that leads us into how treatment plans are developed with patients, and that's kind of what they were alluding to, is, Dr. Hall, that you went into this with a fighting attitude.
Well, absolutely. To answer your question about treatment plans, breast cancer is a team treatment, and there's surgical portions to it. There's chemotherapies, drug treatments, hormone treatments to it, and then radiation treatments. And through all of that, the coordination of that team is important. And one of the things we're very, very fortunate here in Logansport and the surrounding area is to have partnerships with excellent radiation oncology and with hematology oncology. The doctors do the chemotherapy. We established a relationship with the St. Vincent folks a long time ago. In fact, Ray Harwood, who's the primary medical oncologist that comes here from Indianapolis, he's been coming here 20-some-odd years, 25 years, something like that. And his group now has 3 physicians that come to Logansport, and 1 goes to Peru. The radiation oncology is the St. Vincent Community Hospital in Indianapolis joined their radiation oncology units and put a radiation unit here and put 1 in Peru. And Dr. John Marvel primarily runs that, and the one over in Peru, John runs part of that, and then another radiation oncologist, Drayton Logan, participates in that. So the fortunate thing we have is that those modalities, which are really high-tech, we have the best of Indianapolis that have offices and treatments here. So you don't have to travel for the chemotherapy. You don't have to travel for the radiation therapy. The surgical aspect of it, we've got all the bells, whistles, and gadgets to do here that you can do and need to treat the disease, short of a plastic surgeon. And someday we hope to solve that piece of the puzzle. But the treatment is, of course, based on early diagnosis, and that comes with screening programs and clinical exams, and then the availability of modalities to make the diagnosis. And so when you're trying to find a 4 millimeter abnormality in the breast, you have to have some way of doing that, and that's primarily done with imaging studies, either needle biopsies under mammogram guidance or needle biopsies under ultrasound guidance, which is relatively new, but we've got the equipment to do that here, and that really, really works well. We're also fortunate here to have a breast MRI unit. Not very many towns this size have a breast MRI unit, but we do have a breast MRI unit that can be used to try to find things where MRI may be better than imaging. So, once you find an abnormality that needs investigated and do the biopsies, then you sit down with the consultants and come up with a battle plan.
And I guess, are there things that you ladies would like to speak to as far as that as well, with treatment plans and your particular experiences?
Well, I am from Peru, so I went to the cancer doctor there. And one of the first things he told me, he said, you've got a whole team. Everyone in Indianapolis sees your report, sees everything. We discuss it, and we come the best way to help you. And I just trusted him. He's a wonderful doctor. He takes all the time in the world with you, so you might be sitting in the office for 2 hours before you ever get into him, because he won't rush anyone out. But one of the things I did want to mention is the unsung heroes. These are the ladies that work, that give you your chemo. They are just precious, sweet, kind as can be. And then radiation is the same way. If you go into chemo or to radiation down, depressed, or whatever, you can't stay that way, because these ladies are just so precious. And when you're with the cancer, you go in, you don't need to be with somebody that's negative or down or not in a good mood or whatever, because then that just knocks you against the wall. But I just want to say how much I appreciate these people. And they are, like a lot of other medical people, they're unsung heroes, because they do so much, not only for you physically, they do so much for you mentally. And I was blessed for everyone that I met during my treatment.
Marianne or Lana, anything you guys want to add to that?
And I just believe, Corinne, we probably ran into some of the same people. And I agree. I mean, they're very helpful. They will get you, if you need water, something to drink, a blanket, a pillow, Yes, they are there to help out. And I agree. They are the unsung heroes, and we thank you all.
Yes.
Well, I would have to say that the same thing the girls said, but one of the gals that works up there that gives you the chemo, I knew her dad clear back when I was in high school, and he got lung cancer, very unexpected, and she was dealing with that and dealing with us, and she still had a positive attitude, and those girls were just like friends, and I'd still go up there every now and then and just say hello or something to them, because it's like family. Not that I want to have cancer all the time, go see them, but it makes you feel good to know that people care about you like they do.
Now, as far as other resources in the community, are there other resources we haven't touched on yet?
Well, I think, we do have radiology here, which is, I don't know that we've mentioned that, on site, full-time radiology program. And then we also have the our general surgeons, too, who also work with Dr. Hall and do some breast treatment as well. So, I mean, we have an expansive list of services here.
Well, and one of the things that we kind of touched on the first half hour was really, for a community of our size, what valuable resources we have right here in our own community.
we're really very lucky to have what we have. But I mean, it's really not luck. I mean, it's been planning and work by our physicians locally and hospital administration over many, many years to make sure that these resources are here and continue to be available for family members and community members. And like they've all said, it just makes it easier for the family. I mean, it's not just them, it's their family members and their friends, and it helps them too by not having to travel distances for their treatment.
Now, Vicki, we've discussed this before on the show, but can you tell us again about the grant program that Memorial Hospital has available to assist with free screening mammograms?
We do. We participate in the Indiana Breast Cancer Trust Program, which is, when you buy the breast cancer license plates, a portion of those proceeds go towards grants that hospitals and other not-for-profits can get, and then those funds are used to provide free mammograms to women who are uninsured or underinsured. We have that program. We actually have the opportunity to give away 90 mammograms this year. We're not even halfway there yet, and I'm hoping, one of the outcomes from today is that people have heard you all and have heard, why it is so important to have that screening mammogram and to call the hospital and get scheduled for a mammogram. If you're uninsured, underinsured, you just don't have any way to pay for a screening mammogram, we can assist with that as well.
All right. Now, we've touched on this as well, but as we kind of wind down today, from each of the survivors, what advice would you give to other people who have recently been diagnosed with breast cancer or any other type of cancer? Marianne, do you want to start?
Yeah, I would say that you need to listen to the doctors. Ask lots of questions. I would go into Dr. Hall's office, into the chemo, my oncologist, into the radiation with questions. I had a notebook and I wrote things down, and I would ask lots of questions, and they always answered everything. And if they didn't know, one time I asked the radiologist about giving blood, and they weren't sure. I went in for my treatment, and when I came out, they had the answer. They had called to find out when and if I could give blood. So you need to be educated. You need to, ask the questions. And, again, you need to stay upbeat and positive, because it is have a lot to do with it, your mental attitude as well.
Corrine?
Oh, I think you said it great. I really don't know what I can add to that, but it is, I'll go back to the same thing, the mental attitude. Friends and family. Another thing, if you want to talk, find somebody you can sit and talk with and be honest with, not hold everything in. If you cry, because that helps get that out and all this. And another thing is, it's, like she said, ask questions. If you have friends that have had cancer before, talk to them so they can tell you what they went through, so a lot of it might not be new to you when you're going to do it. But family support, I think, is terrific, and we all need that. But the main thing is to be positive, and don't be afraid to talk about it to somebody, or don't be afraid to ask questions.
Lena?
Well, one of the things that I'm very fond of, and I think Dr. Hall knows that, my daughter would cry every time we go into the doctor's office, and I said, why am I not crying? I'm not upset about this. And he said, well, your positive attitude will get you farther than my medicine will. But it's faith in God. My faith in God has kept me going, and it's made me appreciate life. Because once you've had cancer, you know that life is so short, and it can be taken away at any time, and you appreciate the sunrises, the sunset, the birds, your children, even the petty gripes in the family. At least, thank God, you've got a family to put up with.
That's right.
So, to me, it's faith and positive attitude. And, of course, Dr. Hall.
And Dr. Hall, what about you? Do you have advice for the women of our community?
I don't know that I could say it any better than what was just said, but I think it's a journey, and the journey begins with ongoing health care, and in many aspects, whether it's cholesterol or whatever. But in the avenue of cancer and breast cancer, it's a journey, and once that diagnosis is made, keeping a positive outlook and not letting the cancer take over your life, not letting it take over your family. Pretty much every cancer patient that I see really has two things on their mind. Number one, am I going to survive? And number two, what's this going to do to my life and my family? And we can provide all the treatments and everything to try to make that really work out well. But positive attitude and a supportive family will probably do as much as my treatments will.
As far as things that will be going on in relation to Breast Cancer Awareness Month, we've talked a little bit about the billboard that's downtown right now featuring the 3 breast cancer survivors that we've heard from today, Corrine Chittum, Marianne Hill, and Lana Moss. Are there other things, Vicki, that the hospital will be doing this month in observance of Breast Cancer Awareness Month?
We will. We actually have our River Bluff Run and Fun Walk coming up next Saturday, October the 12th. And that walk and run is really a celebration of breast cancer awareness. 3 years ago, we transitioned that walk to have it focus on breast cancer awareness. So the resources, again, that we get from that go to the Screening Mammogram Fund. But we use it really kind of as a celebration. So the run actually starts at 9, but between the run and the walk, we will have a special observance this year. Our 3 ladies here will be here, and we'll be recognizing them. But we'll also have a speaker, another breast cancer awareness survivor who actually was featured on the billboard last year, talking with us and sharing her story as well. So we are encouraging people to come run, and if you don't run, come walk. Bring your friends and your families. It's a nice festive day. It doesn't last but just a few hours, but it's fun. I guess it's a nice way to show publicly your support for breast cancer survivors and people that have been impacted by the disease, and family members and friends. So we're hoping that we have a good turnout that day. We've tried something new. If you want to register a team of 5 or more, the cost is reduced to $15 per person, so we're still accepting registrations. I had a lady call yesterday, and I think it's similar. I don't know if she's been involved with Relay for Life or not, but she wanted to bring a tent and some decorations and things down for her family and friends. And so I, said that'd be great. So the more festivities we have, and it's an event that we're really trying to grow, because I think it's important. It just, publicly and visibly shows the need to support breast cancer awareness and to focus on the screening mammograms.
Now, you have some information that you provided to me about the survivors, and it says that they will be available on your website. Is that correct? The survivors, their stories? Mm-hmm. Yes, we will be posting those on on our website, yes. Okay, so people can find out more about the survivors that we've talked to today and your stories. But as we wrap up this morning, we've talked about a lot of things, but are there any final things that you guys would like to share about your lives going forward? I mean, you can wear that banner of survivor now. So I know as we talk, things that other people say sometimes spark things that maybe we haven't talked about yet or touched upon yet. Are there any other things that you guys would like to share this morning about your stories?
Well, my story's a little different. My husband came down with cancer a little over 4 years ago. God was good. He let me have him for 3 years. You would never tell he had cancer. Needless to say, I came down with breast cancer last November, and then in January, my husband started getting worse. So not only was I going through chemo and crawling, I was taking care of a dying husband. And it just proves you can do anything, especially with God's help, because dead weight you can't move. And I did. I rolled him over. I took care of him, and I didn't have anyone else to help. And I could have got really depressed. I could have got down. I could have had the biggest pity party in the world. But I didn't, because I kept saying, tomorrow's going to be a better day. Tomorrow's going to be a better day. And I lost him August the 3rd. So I'm going through quite a bit right now and everything. But I will say that no matter what your downfalls are, no matter what your family positions are or anything, there's always somebody out there worse. There's always somebody out there that's got carrying a higher burden than you do and all this. And I just, like she said, about looking at the sky and thinking how beautiful it is or how beautiful the trees are. The more positive thoughts you have, and if you start thinking negative, just get up and start walking around and shake it off, because being positive will get you so much farther.
Thank you so much for sharing your story today, Corrine. Lina, what about you?
Well, my only thing is that cancer's not going to get me. I'm going to get it, and I look at it this way. It's a win-win situation. My life's in God's hands. If it's time for me to go, I go to heaven. If it's time for me to stay here, then I can help others, and that's my main goal, to bring others up and help them to understand that cancer is not a death sentence.
We certainly appreciate you being here today and sharing your story as well. Marianne, any final thoughts from you?
I just would like to say thank you to my family and my friends for being there, and my coworkers. The whole time I had my cancer, I was able to work, but they were very kind in letting me off work for treatments, for doctor's appointments. People were just very generous and very caring and loving, and I do appreciate that. And I just want to say I urge strongly for every woman to go out and get her mammogram. This is so important, and if you just make it a yearly thing every October, just Breast Cancer Awareness Month, just go schedule your appointment, please.
Dr. Hall, final thoughts from you?
Well, I don't know that I can top that. That's a good way to wrap it up.
All right. And Vicki, again, the information about the free mammogram program that you have, if people have been listening today and would like to take advantage of that, how can they get more information?
They can call, call the hospital, call 753-7541 and ask for information about the free program, and they'll get you with registration.
All right. Thank you all so much for coming in this morning and sharing your stories.
Thank you.
Thank you.
And we will be back tomorrow with more Talk of the Town.